A massive fire broke out on 9th June after 14 days of uncontrollable gas leakage at Bakchan oil field in Assam. The leak resulted in two deaths and the displacement of over 3,000 local people. Yet, there has been a deafening silence about the incident in mainstream media. The state Renault India Limited, the owner of the oil well, has called in foreign experts to get the leak under control. But locals and environmental activists say severe damage has already been done to the biodiversity and essential local agriculture in the area. While each disaster should get its due coverage, the blind eye turned to the Assam oil leak has reignited the old grudge that people from Northeast have regarding mainland India ignoring its issues. Locals from Bakchan have been protesting for the past week over the damage that the gas leak has caused their homes and natural environment. India so far has conducted only 5 million COVID 19 tests, the lowest test numbers in worst 10 COVID 19 affected countries. Apart from low testing rate, India is now the fourth largest COVID 19 affected country. Surprisingly, due to early lockdown, India has a very low fatality rate, that is, just 2.8% of infected people. Indian states which are witnessing an unlock phase 1 are seeing a surge in new cases. On Friday, India reported more than 3 lakh infected cases with highest spurt of 11,500 cases. Continuous violation of safety norms is witnessed across the country where people are seen shopping in markets, loitering on streets and taking a walk around the Marine Drive. Delhi is among the top three metropolitan cities affected by COVID 19. Within the last few days, 2,000 cases have been reported in Delhi, taking the total tally rising above 36,000 cases. Delhi hospitals are admitting cases only after seeing visible symptoms, as there is tremendous pressure on hospital staff and administrations. Mainstream media has recently released videos and reports of patients knocking the doors of different hospitals for admission. Those in hospitals are lacking proper facility and care due to lack of staff. Due to lack of infrastructure, deceased COVID bodies are kept in hospital corridors and general wards, risking health of other patients. As death rate in Delhi is rising higher than the national average at 2.98%, the Supreme Court slammed the Delhi government and asked them to not only provide beds but give patients sufficient treatment and care. Apart from continuous low testing rates, the Delhi government is planning to convert banquet halls, stadiums into makeshift facilities, boosting 30,000 beds. By July 15, Delhi would need over 1,50,000 beds as cases are expected to surge. Nepal Parliament approves new map as dispute with India escalates. India has rejected Nepal's new map, calling it a unilateral act that is not based on historical facts or evidences. The lower house of Nepal's parliament on Saturday approved a new map of the country, including areas disputed with India. The Speaker of the National Legislature said. The move signals a hardening of Nepal's position over a decade long border dispute that has strained ties between the South Asian neighbors. Wildlife conservationists have something to cheer about as India has recorded a 29% increase in the population of Asiatic lions living in Gujarat's Gir forest in the past 5 years, with their population going up from 523 in 2015 to 674 in 2020. The increase in the lion count this year shows one of the highest growth rates so far. Last year, India had reported similar increasing figures on tiger population. The country had recorded the highest ever increase, 33% in the tiger population from 2,226 in 2014 to 2,967 in 2018. virus is causing disease, while fake news is causing panic and fear across the world. Another fake news has hit the internet showing a through prescription written on a senior consultant's notepad of Delhi's Sir Gangaram Hospital. The message of the prescription is asking COVID 19 contacts to home quarantine themselves and is suggesting preventive medicines like hydroxychloroquine and vitamin C, supplements to be consumed by everyone apart from following social distancing, hand hygiene, and wearing masks. To this viral message, Sir Gangaram Hospital official handle Twitter dismissed the prescription as fake and clarified that someone has circulated a fake image and forged the doctor's signature, and the hospital strongly dissociates itself from such messages. It is advised to take medicine under doctor's guidance only.